Good afternoon, everybody. Myself, Dr. Sushant Kumar Badatya. Welcome to this Facebook live session of Upload Cradle. In this session, we'll be discussing how to deal with the adverse effect after a vaccination. So, we all should know that vaccination is considered as the biggest gift of medicine that has given us in the recent era, because it is the only method to give immunity against multiple diseases that is known as vaccine preventable diseases. So even if we are talking about the adverse effects today, but it should not create a doubt about safety of a vaccine. So we should be clear about this fact that vaccines are very safe, and it usually takes around 5 to 10 years of hard research and development process before a vaccine is released into the market and it's offered for the issues in the community. So, but even if we are considering safe, some events may happen after the vaccination process that may hurt the baby. We can call it the adverse event following immunization, or generally AEFI. So this is any unwanted or unexpected change in health that happens after someone receives a vaccine that we can call as an adverse event after immunization. So the fact is that the adverse event may or may not caused by the vaccine itself. So vaccine-related adverse effect can be of different types. Some of them may be just a coincidental event that parents may relate with the vaccination itself, but it's not due to the vaccination per se. Some events do happen that are related to the vaccine product itself. So that is called vaccine product related reactions. And some may occur due to defective vaccine, that is either due to production that faulty batch, or due to faulty storage. So the vaccine quality defect related reactions, some of them may happen, and something occurs as related to vaccine giving process itself. That's the immunization related reaction or error related reactions. So any adverse effect should be discussed with your physician itself, and so that he will judge it and classify according to the nature of the reaction. So every reaction may not be due to the vaccine itself. It may be coincident finding also. So we can, for our understanding sake, we can divide into two main groups, that is minor side effects or minor effects, or serious effects. So minor effects may be local or systemic. Like the whole body gets affected, then it's called systemic. So local effect, like there will be local swelling, local pain, or local erythema, redness will be there. Mild pus formation may be there as a part of the vaccine reaction. So these are called the local reactions. And systemic reactions may be manifested as fever, body ache, that is manifested as irritability in babies. There may be loss of appetite. The parents often notice there is a change in feeding pattern of the baby subsequent a few days of the vaccination. So these are called systemic side effect. These are all minor side effects that gets resolved in a day or two with or without medications. But there are some serious side effects or serious effects that may follow a vaccination process, although these are rare. So if it would have been more common, then it will be released in the market. So these are like fits, presence of convulsion or fits, and severe allergy reactions that may happen within minutes of the vaccination, or some reactions may happen within next 1 to 2 days. So severe allergic reactions that manifest in form of whole body rashes, or there will be in breathing difficulty due to windpipe obstruction. And there may be some occasions where there will be weakness of limbs that may due to the vaccine related. So these are called serious adverse effect after vaccination. So this needs to be reported, and there is this pre-designated format where we report these reactions to the authority, so that they investigate further and they then take the actions henceforth. So how to deal with this adverse effect events? So first of all, before you opt for any vaccination or go for any vaccination, discuss thoroughly with your physician or with the pediatrician, so that you will remain informed, so that you anticipate and you will be prepared physically and mentally for the events thereafter. So always get vaccinated in a hospital setting, so that in case of any emergency, you can report to the center immediately, and we avoid vaccination at the home itself. So after the vaccination session, stay in the vaccination center for at least 15 to 20 minutes after vaccination, so that the in case of any adverse event that is a very serious of nature, like severe anaphylactic reactions that may affect the breathing difficulty, breathing part, then you can be attended as quickly as possible. And do remember some danger signs that may appear in the baby in subsequent 1 week, depending upon the type of vaccine, some within 40 hours, some within 1 to 2 weeks. So if baby has fever more than 104 degree Fahrenheit, or baby is crying more than a day, continuously crying despite of giving the feeding and keeping in lap, so for that you should refer to your doctor as soon as possible. If there is any swelling that is worsening with hours where the injection was given, then it is a concern. If there is any rashes that is increasing with time, there is unusual sleepiness, the baby is not waking up despite of much effort, then this is called a lethargic response that should be reported. If there is any blood in stool or severe vomiting episodes, then these are the conditions where should seek the opinion of the doctor. So we can discuss the few minor side effects that are very commonly we encounter in our practice, and for those conditions parents get often frightened. So like at birth we give BCG vaccination for tuberculosis, the prevention of the severe manifestation of tuberculosis. Then this vaccine is given in the left arm deltoid region. So this vaccine manifests in 4 to 6 weeks after the first injection. So it manifests as a minor nodule in the first place that ulcerates over the next 1 to 2 weeks, and some minor pus discharge may be there. So that is very normal reactions, and even this is considered a very good vaccine take itself. So that is normal for the part, doesn't need any medications or cleaning process as such. But there may be lymphadenopathy that is manifested as armpit swelling that needs attention, and you should seek the medical facility for that, and depending upon the scenario it may need aspiration or some medications accordingly. But otherwise this vaccine has no other major side effect. And coming to the next vaccination where parents are more apprehensive, like that, the DPT vaccination at 6, 10, 14 weeks or first 6 months of life, where we usually anticipate there is presence of local side effects and systemic side effects. but those are very manageable. And even if we have two different types of vaccinations, like wholesale pertussis and acellular pertussis, that have variable effects in both. And you should have a detailed discussion about the pros and cons of each vaccine. And you should know beforehand that some reactions are anticipated in both type of vaccinations. So medications and the how to do the cold compression of the swelling, you should be aware of that types of reactions beforehand. And your doctor may or may not describe all the side effects to you, but there may be some instances of convulsions, febrile seizures after this vaccination, and there may be some excessive crying episodes. So these are not the side effect alone that will prevent from taking this vaccine. So you should be frank enough to discuss these conditions with the parents. So similarly, MMR, measles, mumps, rubella vaccination at 9 months have similar instance of fever and febrile seizures, but those occur after 7 to 10 days of life. So every vaccination has its own pattern of side effect, but these are all safe. We are talking about the side effects only, but these are very safe vaccines, and those occur like 1 in 100 babies or like that. So every side effect has very different incidence, like some are common, some are very common, some are very rare. So you should discuss with it, and this should not be a deterrent to use the vaccines. So, and biggest myth some parents have with them, that vaccine cause autism, like MMR is associated with the autism. So this is the biggest myth, and it is proven again and again that MMR is not associated with any kind of this developmental disorders, including autism. So at the end of this session, we should remain few practice points, that remain informed about the potential side effects of the vaccines, be discussed, get it discussed with your physicians each time you get the vaccination process. And although we don't discuss each and every side effect with the parents, those rare side effects may not be discussed with you, but if we as we discussed any danger signs, we should approach the physician for the discussion, and keep the medicines ready, so that like this paracetamol after the DPT vaccination or any vaccination, so that if only if baby develops fever or discomfort enough not to be managed otherwise, then only you should use the medications. Preemptive uses of medications has shown to be affect the vaccine take process. So we should not use the the painkillers or antipyretics as such beforehand, prophylactically. So reach out to the hospital if any unusual activity noticed, as discussed earlier. And it is always better to clarify any rumor you hear from your colleagues, or like regarding a vaccine from your pediatrician. So similarly, as of this date, we have launched the vaccination for the COVID for the pediatric age group also, from 15 years onwards. So get vaccinated for those age group, and be safe about from the vaccine preventable diseases. So we can see some questions here. So first question was that are there any side effects and what should do if I suffer from any side effect? As we discussed one by one, so there are some minor side effects and the major side effects. For minor side effects, your doctor will prescribe some remedies and the medications and instructions, you should follow them. And for major side effect, you should report to the concerned authority, and accordingly the remedies will be given. How long do you ever observe and report to side effects to our vaccine? Which side effect take longest to manifest? So the observation period starts immediately after the vaccine is administered. So within first hour or so, there may be some anaphylactic reactions that needs to be manifested within hours, but some side effects like fever or pain that may come after 24 to 40 hours in case of inactivated vaccines, and may come after 7 to 10 days in case of live vaccines. So depending upon the type of vaccine, whether it is an inactivated vaccine or live vaccine, the time lag from injection to the appearance of side effect or the effect itself may vary. So next question comes, what is myocarditis and pericarditis? Can vaccine lead to myocarditis and pericarditis? Myocarditis and pericarditis is the inflammation of the coverings of the heart. So myocarditis is the muscle of itself, that is the inflammation of the heart muscles is called myocarditis. Pericarditis is the inflammation of the covering around the heart. There is a thin layer called pericardium. That when this is inflamed, we call pericarditis. There is no such vaccine exists that has a definitive link to myocarditis or pericarditis. It is always a judgment of the patient that clarifies your situation, that it always a coincident finding. So as of now, literature is not given any reports or association with myocarditis with the vaccine. So similarly, this gives me opportunity to discuss a condition. Sometimes baby develops a pneumonia episode after pneumonia vaccine. So they relate to with the vaccine itself. But these are most of time these are the inactivated vaccines. They don't have the infectivity power. So baby can't be affected with the same disease process due for which the vaccine is given. So next question: what happens if the kid develops an allergic reaction to the first dose? So depends upon the what type of allergic reactions. If it's the life-threatening and serious nature, we always avoid the similar components in the future, and depending upon the what component the vaccine was containing, even some babies are eligible egg containing egg components, then they are avoided for the same baby. So depending upon the type of allergic reactions, we first consider and review if the subsequent series can be completed with the same vaccine, or we can change them. And similarly, apart from allergy reactions, if some baby develops encephalopathy or it becomes that particularly the seizures and encephalopathy, then we avoid that type of vaccines in further course of the baby. So it depends upon the type of allergy reaction, and either it will be skipped, and if it's minor, then it should be continued with it. So next question: can an individual take different brand of COVID-19 vaccine if he needs to be retake the vaccination? So as of now, Ministry of Health has clarified that due to the policy which government has adopted, individual is not as of now permitted to take different brand of vaccines as of now, but science has no data to prove if we are taking different brand of vaccines, it gives an extra advantage. So as of now, you should stick the same brand, and as events unfold, we can update you. So last question I can see, if my child has gotten any surgery, is it okay to them to the vaccination? So immediately after surgery, uh, you can give a period of 1 to 2 weeks, depending upon the type of surgery. Otherwise, there is no harm in taking the vaccination. But generally, due to the sensitive nature of the vaccination, maybe may react excessively. So you can avoid 1 to 2 weeks gap. Otherwise, there is no harm as such. So I think we have finished all these questions. Okay. So concluding, I should emphasize that you should take all the available vaccines for your baby, so that the baby is protected from the vaccine prevent disease, and be informed and be assured that these vaccines are very safe. So thank you.